Hello everyone, my name is Happiness today and I welcome you to yet another episode of discussing mental health conditions. Yesterday we talked about mood disorders and today we'll be talking about obsessive compulsive disorder. Yes, popularly called OCD. So OCD is a form of mental health condition characterized by repeated distressing thoughts and repetitive action, usually compulsive. You see, for OCD to be diagnosed, the person has to have this constant thought in them to do something, even though they have done it before. They tend to repeat this act, usually done to relieve anxiety symptoms. Yeah. So, what are the key factors for diagnosing obsessional compulsive disorder? One, the person has to be obsessed with the action. And what are the actions we're talking about? This involves everyday routine, such as shutting the door, washing of the hands, combing the hair, dressing up, arranging clothes, just tidying things around the environment. This obsession usually causes anxiety for this individual, and for the individual to relieve themselves from this anxiety, they tend to repeat this action. Let's say, for instance, if the person is obsessed with washing their hands or obsessed with living healthy, they tend to wash their hands at every given time. Whatever they touch, or if someone touches them, they tend to wash their hand constantly. This helps them to relieve the anxiety, this helps them to feel better. Now, is this a problem? Yes, because even when it is obviously clean, even when what they are doing doesn't need to be done, they tend to uh, be anxious about it. They tend to repeat the action. Like someone who has gone to bed, knowing that they've already shut their door, even at in fact, they had to go check on the door million and one time, thousands of times, just to be sure that they've closed the door. Even when they have a confirmation that this door is already locked, they frequently go to check on the door. And that's why the name comes with obsessive compulsive. The person is obsessed with this act, and then the person derives a compulsion, like a force driving them to carry out the act. So just like the criteria for diagnosing mental health condition, which is that it must have a significant impact in the person's life, this also applies when diagnosing OCD. Now, routinely washing hands, routinely keeping the environment clean, routinely checking on door if it's locked to be safe, it's not a problem. But when this impacts on the person's functioning, it becomes a problem. That there must be a real impact on that person. Like, this is not whom this person is, but because it causes anxiety in them, because they tend to always do this act, and then resulting to significant distress, we say that this person has OCD. Now, what are the causes of OCD? Just like every other mental health condition, three factors are usually implicated in causes of OCD. One, when there's biological factor, which has to do with either genetic transmission or imbalance in neurotransmitters in the brain. There's also the brain function. In this case, the way the brain transmits information to the person also matters a lot. If there's problem with the brain, maybe resulting as a result of trauma or accident, and then there's problem with nerves transmission, the it can cause OCD, because in this case, we say that this person forgot that they have done this thing and then they repeat it again, constantly repeating the same action. Then environmental factors, this come from stressors from the external environment. Like if one is anxious following anxiety due to post traumatic event, let's say someone who has recently been attacked by robbers in their house, we always have this thought of wanting to go close their door every time, wanting to go search on the door to be ensure that it is locked. So anxiety in this case leading to obsessive compulsive disorder. Another big question is, can OCD be treated? Yes, it can be treated, like, and can be managed. And this is usually involved two basic treatment. One is psychotherapy. You know, you cannot discuss treatment of mental health condition without psychotherapy. So psychotherapy involves talking therapy, CBT to help correct maladaptive behavior and to help channel the person's thought into a more valuable and positive way. So another treatment of choice, of course, is the pharmacotherapy, which involves the use of medication. And most medication that is used in treating OCD are usually antidepressants, especially the serotonin reuptake inhibitor or selective serotonin reuptake inhibitor, the SS RIs. Example is sertraline. And just like anxiety or other mood disorders, antidepressant does not work magic. It takes time. Usually, it takes up to 12 weeks for it to fully come into action. So don't expect magic when you start taking medications to treat some mental health condition or to treat your OCD. It takes time and it's usually a gradual process. If you want to enjoy more videos like this, like, share, and follow. And I'll see you some other time while we discuss other mental health conditions. Thank you very much. I remain my humble self. Happiness today. Peace.